So we are here at the General Hospital in Luque, Paraguay with Dr. Hector Pedraza from the IMAHelps team. And he's with a young man, and Dr. Pedraza is going to tell us what's going on with this young man and what does he need and what do we need to do.
All right, so this young man had a diagnosis of some bone cancer in his humerus and had essentially his entire humerus removed. They've done a couple other surgeries to try to restore the bone in there, but thus far it's been complete failure. So you can see that, I can move this and all that's in there is muscle. There's no bone. Now, trata doblar el codo.
Doblar.
So it's just hanging there.
Yeah, and he's trying to bend his elbow now. Trata otra vez. And you can see all that happens is his muscle. Now, if I hold him down, ahora doblalo, he's able to bring his forearm up a little better. So theoretically, if we could reestablish some bone in here, then he would have a functional arm. Whereas right now, it just hangs there. So we're trying to see if we can get some referral to the United States to try to get this accomplished, but I think it's going to require probably a microvascular procedure with a bone transfer.
Is that something that is costly or difficult to do in the United States?
It's both. It's costly and it requires specialists because it's done under, the connection of the artery is done under a microscope. And of course, the implantation of the bone is not an everyday procedure. It's something that would be done at a medical center.
And is this something that he was just born with, or what exactly happened?
No, he actually was diagnosed with bone cancer.
I see.
And that's been treated and he's been cured, but he's left without a functional arm, basically.
So they had to remove part of the bone? Is that what happened?
That's right.
I see. So they removed the cancerous part of the bone, and now he's left with basically an arm he can't really use.
Correct.
And so the benefit for him from the surgery would be the use of his right arm.
Right. It would basically give him, 80-90% function of his arm as compared to maybe 10% function right now.
Right, right. And so his economic future is really depending on what happens with this arm, I would imagine, as well as his quality of life.
I agree with that.
Right. Okay, very good. Thank you.
Okay.